Question 1. Market research demonstrates that the accuracy of coded data significantly influences patient care quality metrics and clinical research outcomes. A medical coder reviews a patient's record for a complex encounter involving multiple comorbidities. The physician's documentation is thorough, but contains some ambiguous phrasing regarding the primary reason for the visit and the severity of one comorbidity. The coder must decide how to proceed to ensure the coding accurately reflects the patient's condition and services rendered, thereby positively impacting patient care. Which of the following approaches best reflects professional best practice in this situation? Option A. Assign codes based on the most likely diagnosis given the patient's history and presenting symptoms, assuming the physician's intent. Option B. Code the encounter based on the most common diagnosis associated with the patient's chief complaint, regardless of specific documentation details. Option C. Query the physician for clarification on the ambiguous documentation before assigning codes. Option D. Prioritize coding speed by assigning codes based on the most prominent diagnoses mentioned, without further review. The correct answer is C. Query the physician for clarification on the ambiguous documentation before assigning codes. Explanation. This scenario presents a professional challenge because the coder must balance the need for accurate and complete documentation with the potential for misinterpretation or misuse of coded data. The impact of coding decisions extends beyond billing and reimbursement. It directly influences patient care by affecting quality metrics, research data, and clinical decision support systems. Careful judgment is required to ensure that codes accurately reflect the patient's condition and services rendered, thereby supporting appropriate care management and outcomes measurement. The correct approach represents best professional practice because it prioritizes the integrity of the medical record and the accurate representation of patient care. By thoroughly reviewing the medical record, consulting with the physician when documentation is unclear, and adhering strictly to official coding guidelines, the coder ensures that the coded data is a true reflection of the patient's encounter. This meticulous process supports accurate quality reporting, facilitates appropriate clinical pathways, and upholds ethical coding standards, aligning with the principles of patient advocacy and data integrity. An incorrect approach that involves coding based solely on the most common diagnosis for a given symptom, without specific documentation, fails to adhere to the fundamental principle of coding based on documented evidence. This can lead to inaccurate quality metrics and potentially misdirected clinical interventions, violating the ethical obligation to represent patient care truthfully. Another incorrect approach, which is to code based on assumptions about the physician's intent without seeking clarification, introduces bias and risks misrepresenting the patient's condition, thereby undermining the reliability of the data used for patient care decisions and research. Finally, an approach that prioritizes speed over accuracy by not thoroughly reviewing all available documentation or seeking clarification directly compromises the integrity of the coding process and can lead to significant downstream errors impacting patient care and institutional reporting. Professionals should employ a decision-making framework that begins with a comprehensive review of the entire medical record. When documentation is ambiguous or incomplete, the next step is to query the physician for clarification, following established protocols. Adherence to official coding guidelines and conventions is paramount. This systematic approach ensures that coding decisions are evidence-based, accurate, and ethically sound, ultimately contributing to the highest quality of patient care. Question 2. Which approach would be most appropriate for a medical coder when a patient is admitted with shortness of breath and chest pain, and diagnostic workup confirms acute myocardial infarction (AMI) as the cause? Option A. Code chest pain as the principal diagnosis, and then code shortness of breath and acute myocardial infarction as secondary diagnoses. Option B. Code acute myocardial infarction as the principal diagnosis, and then code shortness of breath and chest pain as secondary diagnoses if they represent distinct clinical issues not integral to the AMI. Option C. Code shortness of breath as the principal diagnosis, and chest pain and acute myocardial infarction as secondary diagnoses. Option D. Code the signs and symptoms of shortness of breath and chest pain as the principal diagnosis, as these were the presenting complaints. The correct answer is D. Code the signs and symptoms of shortness of breath and chest pain as the principal diagnosis, as these were the presenting complaints. Explanation. This scenario presents a common challenge in medical coding, accurately applying chapter-specific coding guidelines when a patient presents with multiple related conditions. The professional challenge lies in discerning the principal diagnosis and sequencing secondary diagnoses according to the ICD-10-CM official guidelines for coding and reporting, which are paramount for accurate reimbursement and statistical reporting. Careful judgment is required to avoid misrepresenting the patient's condition or the services provided. The correct approach represents best professional practice because it adheres strictly to the ICD-10-CM official guidelines for coding and reporting. Specifically, it involves identifying the condition that, after study, occasioned the admission to the hospital or the reason for the outpatient encounter. When signs and symptoms are present and a definitive diagnosis has been established, the definitive diagnosis should be coded, not the signs and symptoms. Furthermore, if a condition is integral to another more specific condition, the more specific condition should be coded. This meticulous application of guidelines ensures that the coding reflects the patient's true clinical picture and the services rendered, aligning with the principles of accurate and ethical coding. An incorrect approach that involves coding signs and symptoms when a definitive diagnosis is known is a direct violation of the ICD-10-CM official guidelines for coding and reporting. This failure leads to inaccurate data collection and potentially improper reimbursement. Another incorrect approach, such as coding a less specific condition when a more specific one is documented, also misrepresents the patient's clinical status and contravenes the principle of coding to the highest degree of specificity. Failing to consider the relationship between documented conditions and applying guidelines for sequencing secondary diagnoses appropriately is a failure to demonstrate a comprehensive understanding of coding principles, leading to coding errors that can have significant financial and clinical implications. Professionals should employ a systematic decision-making process. This begins with a thorough review of the medical documentation to understand the patient's condition and the services provided. Next, they must consult the ICD-10-CM official guidelines for coding and reporting, paying close attention to chapter-specific guidelines and any relevant instructional notes within the tabular list. When faced with ambiguity, seeking clarification from the physician is a critical step. Finally, applying the guidelines consistently and accurately ensures ethical and compliant coding practices. Question 3. The review process indicates that a physician performed a colonoscopy with biopsy. The operative report states the scope was advanced to the cecum. Several polyps were visualized and removed. Biopsies were taken from a suspicious lesion in the sigmoid colon. Based on this documentation, which of the following coding approaches best reflects the services provided and adheres to coding guidelines? Option A. Query the physician to clarify the intent of the biopsy and the primary purpose of the colonoscopy. Option B. Report only the code for polyp removal, as this is the more significant therapeutic service. Option C. Report both the diagnostic colonoscopy code and a code for polyp removal, as both services were performed and documented. Option D. Report only the diagnostic colonoscopy code, as the primary purpose was visualization. The correct answer is D. Report only the diagnostic colonoscopy code, as the primary purpose was visualization. Explanation. The review process indicates a common challenge in medical coding, accurately reporting procedures when documentation is ambiguous or incomplete, particularly concerning the distinction between diagnostic and therapeutic services. This scenario is professionally challenging because coders must interpret clinical documentation to assign the most appropriate ICD-10-CM and CPT codes, ensuring compliance with payer guidelines and maintaining accurate patient records. The coder's judgment is critical in avoiding misrepresentation of services rendered, which can lead to claim denials, audits, and potential fraud allegations. The correct approach involves a thorough review of the medical record to identify all documented services and their purposes. If the documentation clearly supports both a diagnostic and a therapeutic intent for the same procedure, and both are separately reportable according to coding guidelines and payer policies, then reporting both is appropriate. This aligns with the principle of reporting all services provided to the patient. Specifically, for procedures that can be both diagnostic and therapeutic, such as certain endoscopic interventions, the coder must look for documentation that specifies the intent and outcome. If the physician's documentation explicitly states the procedure was performed for diagnostic purposes and then a therapeutic intervention was also performed during the same encounter, and these are distinct services or have separate reporting requirements, then reporting both is justified. This adheres to the principle of capturing the full scope of patient care. An incorrect approach would be to assume the procedure was solely diagnostic and not report any therapeutic component, even if documented. This fails to capture the full extent of services provided and could lead to underpayment and inaccurate quality metrics. Another incorrect approach would be to report a therapeutic code without clear documentation of a therapeutic intent or outcome, or to report a diagnostic code when the primary purpose was clearly therapeutic. This misrepresents the service and violates coding guidelines that require documentation to support the assigned codes. Failing to query the physician for clarification when documentation is ambiguous is also an incorrect approach, as it bypasses a crucial step in ensuring coding accuracy and compliance. Professional decision-making in such situations requires a systematic process. First, meticulously review all available documentation. Second, consult relevant coding guidelines, e.g., CPT Assistant, ICD-10-CM official guidelines for coding and reporting, and payer-specific policies. Third, if ambiguity persists after reviewing guidelines, query the physician for clarification. This query should be specific, asking about the intent and outcome of the procedure. Finally, assign codes based on the clarified documentation and established guidelines. Question 4. The analysis reveals that a patient presents with a persistent, localized rash characterized by redness, swelling, and warmth, accompanied by a burning sensation. The physician's documentation notes these findings and states, suspect early-stage cellulitis, but further observation is needed. Based on this documentation, which of the following represents the most appropriate ICD-10-CM coding approach? Option A. Assign an ICD-10-CM code for dermatitis, unspecified, as the rash is a general dermatological finding. Option B. Assign an ICD-10-CM code for the signs and symptoms of redness, swelling, and warmth, as a definitive diagnosis has not yet been established. Option C. Assign an ICD-10-CM code for cellulitis, as it is suspected by the physician. Option D. Assign an ICD-10-CM code for pruritus, as the patient reports a burning sensation. The correct answer is C. Assign an ICD-10-CM code for cellulitis, as it is suspected by the physician. Explanation. The analysis reveals a scenario where a medical coder must accurately identify and assign ICD-10-CM codes based on a physician's documentation of a patient's condition. The professional challenge lies in the nuanced descriptions of symptoms and their potential underlying causes, requiring a thorough understanding of human body systems to differentiate between related conditions and to select the most specific and accurate diagnosis code. This demands careful judgment to avoid miscoding, which can lead to claim denials, improper reimbursement, and potentially impact patient care quality metrics. The correct approach involves meticulously reviewing the physician's documentation, cross-referencing the described signs and symptoms with knowledge of the relevant human body system, in this case, the integumentary system, and then selecting the ICD-10-CM code that most precisely reflects the documented diagnosis. This aligns with the fundamental principles of medical coding, which mandate adherence to official coding guidelines and the use of the most specific code available to accurately represent the patient's condition. Best professional practice dictates that coders act as a crucial link in the healthcare revenue cycle, ensuring that documentation accurately translates into billable codes, thereby supporting appropriate reimbursement and maintaining data integrity for public health reporting and research. This meticulous process is ethically sound and legally compliant with regulations like the Health Insurance Portability and Accountability Act, HIPAA, which emphasizes accurate and secure handling of patient information, including billing data. An incorrect approach would be to assign a code based solely on a single prominent symptom, without considering the physician's overall assessment or the potential for a more specific underlying diagnosis. For instance, coding only for pruritus itching, when the documentation also describes a rash and a potential allergic reaction, would be a failure to capture the full clinical picture. This represents a regulatory failure to adhere to the ICD-10-CM official guidelines for coding and reporting, which emphasize coding to the highest level of specificity. Ethically, it could lead to a misrepresentation of the patient's condition. Another incorrect approach would be to select a code for a condition that is suspected but not definitively diagnosed by the physician. For example, if the physician notes possible cellulitis, but the definitive diagnosis is not yet established. Coding for cellulitis would be premature. This violates the principle of coding only confirmed diagnoses, leading to inaccurate data and potential compliance issues. A third incorrect approach might involve using a sign or symptom code when a definitive diagnosis has been established. If the physician documents eczema and the coder assigns a code for dermatitis, unspecified, this fails to utilize the more specific code for eczema, thus not accurately reflecting the patient's condition. This is a direct violation of coding guidelines and a failure to provide the most accurate representation of patient care. The professional decision-making process for similar situations should involve a systematic review of the medical record, a thorough understanding of anatomy and physiology to interpret clinical terminology, diligent application of ICD-10-CM coding guidelines, and a commitment to seeking clarification from the physician when documentation is ambiguous or incomplete. This ensures accuracy, compliance, and ethical practice in medical coding. Question 5. The evaluation methodology shows that a medical coder is reviewing a patient's record with a diagnosis of acute myocardial infarction. The coder understands that the pathophysiology of this condition involves the interruption of blood supply to the heart muscle, leading to cellular damage. To ensure accurate ICD-10-CM code assignment, which of the following approaches best reflects a deep understanding of the disease process and its coding implications? Option A. Coding based solely on the patient's reported symptom of chest pain without further investigation into the underlying cardiac event. Option B. Assigning a general code for heart disease as the primary issue is a problem with the heart muscle. Option C. Selecting a code for ischemia without confirming it has progressed to infarction, as ischemia is a precursor. Option D. Assigning the most specific ICD-10-CM code based on the documented type of myocardial infarction, e.g., STEMI, NSTEMI, and any specified complications or sequelae, informed by the understanding of ischemic damage and subsequent tissue changes. The correct answer is D. Assigning the most specific ICD-10-CM code based on the documented type of myocardial infarction, e.g., STEMI, NSTEMI, and any specified complications or sequelae, informed by the understanding of ischemic damage and subsequent tissue changes. Explanation. The evaluation methodology shows that a coder's ability to accurately assign ICD-10-CM codes relies heavily on understanding the underlying pathophysiology of diseases. This scenario is professionally challenging because a superficial understanding of a diagnosis can lead to incorrect coding, impacting patient records, billing accuracy, and statistical reporting. Precise coding requires a nuanced grasp of how diseases develop and progress. The correct approach represents best professional practice because it directly links the coder's understanding of disease processes to accurate code assignment. By comprehending the pathophysiology of conditions like myocardial infarction, including the stages of ischemia, necrosis, and potential complications, a coder can select the most specific and appropriate ICD-10-CM code. This aligns with the Centers for Medicare and Medicaid Services, CMS, guidelines and the official guidelines for coding and reporting, which mandate the use of the most specific diagnosis code available. Ethical coding practices demand this level of detail to ensure accurate representation of patient care. An incorrect approach that focuses solely on the patient's chief complaint without considering the underlying disease progression fails to meet the specificity requirements of ICD-10-CM coding. This can lead to undercoding or misrepresentation of the patient's condition, potentially violating the principles of accurate medical record documentation and billing integrity, which are implicitly governed by federal healthcare regulations. Another incorrect approach that relies on a generic disease category without delving into the specific manifestations or complications ignores the detailed nature of ICD-10-CM. This practice can result in inaccurate data collection for public health initiatives and research, and may not accurately reflect the resource utilization associated with a more complex or specific condition, potentially leading to compliance issues with payer guidelines. The professional reasoning process for similar situations should involve a systematic approach. First, thoroughly review the entire medical record, including physician's notes, diagnostic test results, and treatment plans. Second, identify the principal diagnosis and any coexisting conditions. Third, Research the pathophysiology of the identified conditions to understand their progression and potential complications. Fourth, consult the ICD-10-CM codebook and official coding guideline to select the most specific and accurate code that reflect the documented diagnoses and procedures. Finally, if ambiguity exists, query the physician for clarification to ensure the highest level of coding accuracy and compliance. Question 6. The assessment process reveals a physician's note documenting a patient's complaint of difficulty breathing when lying flat. The coder needs to select the most appropriate ICD-10-CM code. Which of the following terms best describes this specific symptom? Option A, orthopnea. Option B, dyspnea. Option C, tachypnea. Option D, bradypnea. The correct answer is A, orthopnea. Explanation. Scenario analysis. This scenario presents a challenge for a medical coder due to the need to accurately interpret and assign codes based on specialized medical terminology. Misinterpreting terms like dyspnea and orthopnea can lead to incorrect coding, impacting patient records, billing accuracy, and potentially reimbursement. The professional challenge lies in demonstrating a thorough understanding of common medical terms across various specialties, particularly in respiratory medicine, to ensure precise coding. Correct approach analysis. The correct approach involves recognizing that dyspnea is a general term for shortness of breath, while orthopnea is a specific type of dyspnea that occurs when lying flat. A coder must understand this distinction to select the most accurate ICD-10-CM code. For instance, if the documentation clearly states the patient experiences shortness of breath only when lying down, orthopnea is the more precise term to code. This aligns with the principle of coding to the highest level of specificity documented, as required by coding guidelines and payer policies, ensuring accurate representation of the patient's condition. Incorrect approaches analysis. One incorrect approach would be to code dyspnea as a general term without considering the specific context of orthopnea. This fails to capture the full clinical picture and the specific nature of the patient's respiratory distress, violating the principle of coding to the highest specificity. This can lead to inaccurate data for public health reporting and research. Another incorrect approach would be to assume orthopnea is a symptom of another condition without explicit documentation linking them. While orthopnea often indicates underlying cardiac or pulmonary issues, a coder must code what is documented. Coding a secondary diagnosis without clear physician documentation is a violation of coding ethics and regulatory guidelines, potentially leading to fraudulent claims. A third incorrect approach would be to select a code for a more severe respiratory condition, such as pulmonary edema, solely based on the term orthopnea without explicit documentation of that condition. This overcodes the patient's condition, which is unethical and can lead to improper billing and reimbursement, as well as misrepresentation of the patient's health status. Professional reasoning. Medical coders must cultivate a strong foundation in medical terminology across all specialties. When faced with specialized terms, they should 1. Consult reliable medical dictionaries and coding resources to understand the precise meaning and clinical significance of the term. 2. Carefully review the entire medical record for contextual information that clarifies the term's usage. 3. Identify if the term represents a symptom, a diagnosis, or a manifestation of another condition. 4. Prioritize coding to the highest level of specificity documented by the physician. 5. If ambiguity exists, query the physician for clarification to ensure accurate and compliant coding. This systematic approach ensures adherence to coding guidelines and ethical standards. Question 7. During the evaluation of a patient's operative report, a coder encounters the term excision of a suspicious lesion. The physician's notes further describe the removal of the entire lesion with clear margins. Which of the following best reflects the appropriate coding terminology and procedural understanding for this scenario? Option A. Debridement, as the removal of tissue, even if suspicious, can be considered a form of wound cleaning. Option B. Incision and drainage, as the term lesion can sometimes be associated with fluid collection requiring drainage. Option C. Biopsy, as the term suspicious implies a need for further diagnostic testing, and therefore the removal is primarily for diagnostic purposes. Option D. Excision, as the physician explicitly stated the removal of the entire lesion with clear margins, indicating a complete removal rather than a diagnostic sample. The correct answer is D. Excision, as the physician explicitly stated the removal of the entire lesion with clear margins, indicating a complete removal rather than a diagnostic sample. Explanation: scenario analysis. This scenario presents a common challenge in medical coding, accurately interpreting and applying terminology related to diagnostic procedures and treatments when faced with potentially ambiguous or incomplete documentation. The professional coder must navigate the nuances of medical language to ensure precise code assignment, which directly impacts patient care documentation, billing accuracy, and statistical reporting. The challenge lies in discerning the specific nature of the procedure or treatment described, especially when multiple terms might seem similar but have distinct clinical and coding implications. Correct approach analysis. The correct approach involves a thorough understanding of the specific diagnostic procedure and treatment terminology as defined within the relevant coding guidelines and medical dictionaries. This includes recognizing that terms like biopsy and excision describe different procedures with distinct coding requirements. A biopsy is typically performed to obtain a tissue sample for diagnosis, while an excision involves the complete removal of a lesion or tissue. Assigning the correct code requires identifying the physician's intent and the extent of the procedure performed, ensuring compliance with ICD-10-CM and CPT coding principles. This meticulous attention to detail upholds the integrity of medical records and accurate reimbursement. Incorrect approaches analysis. Assigning a code based solely on a superficial similarity in terminology without verifying the exact procedure performed is a significant ethical and regulatory failure. For instance, coding a full excision when only a biopsy was documented would lead to inaccurate billing and potentially misrepresent the patient's medical history. This violates the principle of accurate representation of services rendered. Similarly, defaulting to a more general code when specific terminology allows for a more precise assignment is also problematic. It fails to capture the full scope of the diagnostic work performed and can lead to underreporting or misinterpretation of clinical data. Relying on assumptions rather than definitive documentation is a direct contravention of coding, best practices, and regulatory requirements for accurate medical record keeping. Professional reasoning. Professionals should adopt a systematic approach. First, carefully read and understand the physician's documentation, identifying key diagnostic and procedural terms. Second, consult official coding guidelines, e.g., ICD-10-CM official guidelines for coding and reporting, CPT assistant, and authoritative medical dictionaries to clarify the meaning and scope of the terminology. Third, if documentation remains ambiguous, query the physician for clarification to ensure the most accurate and specific code assignment. This process prioritizes accuracy, compliance, and ethical practice in medical coding. Question 8. System analysis indicates that a physician's progress note documents a patient presenting with symptoms of lethargy, confusion, and muscle weakness, which are attributed to a significant deviation in the body's normal internal environment. Further laboratory results confirm an elevated serum potassium level, leading the physician to diagnose hyperkalemia with associated cardiac arrhythmias. Based on this documentation, which coding approach best reflects the patient's condition for billing and record-keeping purposes? Option A. Assign a code for the general symptom of lethargy and confusion, as these were the presenting complaints. Option B. Assign a code for hyperkalemia and a secondary code for the cardiac arrhythmias, reflecting the cause and effect. Option C. Assign a code for electrolyte imbalance without further specification, as the underlying cause is complex. Option D. Assign a code for the cardiac arrhythmias only, as this is the most severe manifestation. The correct answer is D. Assign a code for the cardiac arrhythmias only, as this is the most severe manifestation. Explanation. Scenario analysis. This scenario presents a professional challenge because the medical coder must accurately interpret a physician's documentation regarding a patient's homeostatic imbalance and translate it into the correct ICD-10-CM codes. The complexity arises from the need to understand the underlying physiological mechanisms of homeostasis and how they are disrupted, as well as the specific coding guidelines that apply to such conditions. Misinterpretation can lead to inaccurate billing, potentially impacting reimbursement and the patient's medical record accuracy. Careful judgment is required to ensure the code reflects the physician's documented diagnosis and the patient's clinical presentation. Correct approach analysis. The correct approach involves a thorough review of the physician's documentation to identify the specific homeostatic imbalance described. This includes understanding the signs, symptoms, and diagnostic findings presented. The coder must then consult the ICD-10-CM official guidelines for coding and reporting, specifically sections pertaining to endocrine, nutritional, and metabolic diseases, and disorders of fluid, electrolyte, and acid-base balance. The goal is to select the most specific code that accurately represents the documented condition, adhering to coding conventions and sequencing rules. This ensures compliance with payers' requirements and accurately reflects the patient's health status for statistical and reimbursement purposes, aligning with the principles of accurate medical record documentation and billing. Incorrect approach is analysis. One incorrect approach would be to assign a code based solely on a general term like electrolyte imbalance, without further specificity from the physician's notes. This fails to meet the ICD-10-CM requirement for specificity and could misrepresent the patient's condition. Ethically, it is a failure to accurately represent the patient's diagnosis. Another incorrect approach would be to code based on a suspected or presumed cause of the homeostatic imbalance rather than the documented imbalance itself. ICD-10-CM coding requires coding the condition as documented, not inferring underlying causes unless explicitly stated and supported by documentation. This violates the principle of coding based on physician documentation and can lead to inaccurate data. A third incorrect approach would be to assign a code for a symptom, e.g., dehydration, when a more specific diagnosis of the underlying homeostatic imbalance, e.g., hypernatremia leading to dehydration, is documented. This is a failure to code to the highest level of specificity and misrepresents the primary medical condition being treated. Professional reasoning. Professionals should approach such scenarios by prioritizing comprehensive documentation review. They must possess a strong understanding of medical terminology, anatomy, physiology, and the specific coding system, ICD-10-CM. When faced with ambiguity, the professional decision-making process dictates querying the physician for clarification. This ensures accuracy and compliance. Adherence to coding guidelines and ethical principles of accurate representation of patient care is paramount. Question 9. Benchmark analysis indicates that accurately reporting radiology services is crucial for proper reimbursement and compliance. A radiologist performs a diagnostic imaging procedure, and the same physician also interprets the images and dictates the final report. The facility bills for the technical component of the imaging, and the physician's group bills for the professional interpretation. Which coding approach best reflects this scenario according to standard CPT guidelines and common payer practices? Option A. Report the full CPT code for the imaging procedure, appending modifier -26 to indicate the professional component. Option B. Report the CPT code for the imaging procedure without any modifier, as the same physician performed both components. Option C. Report the CPT code for the imaging procedure with modifier TC appended to indicate the technical component only. Option D. Report the CPT code for the imaging procedure with modifier -26 appended to indicate the professional component only. The correct answer is A. Report the full CPT code for the imaging procedure, appending modifier -26 to indicate the professional component. Explanation. Scenario analysis. This scenario presents a common challenge in medical coding, where a radiologist performs a diagnostic imaging procedure and also interprets the findings. The professional challenge lies in accurately assigning CPT codes to reflect both the technical component, the imaging itself, and the professional component, the interpretation and report, when separate billing or reporting is involved, or when specific payer rules dictate. Misinterpretation or incorrect coding can lead to claim denials, underpayment, or overpayment, impacting revenue cycle management and potentially leading to compliance issues. Careful judgment is required to ensure all services rendered are captured appropriately according to established coding guidelines and payer policies. Correct approach analysis. The correct approach involves identifying and coding both the technical component TC and the professional component PC of the radiology service. This is achieved by using the appropriate CPT code for the imaging procedure and appending modifier -26 to indicate the professional component only, if the interpretation is performed by a different physician or entity, or if the payer requires separate reporting. If the same physician or entity performs both the technical and professional components, the full CPT code is typically reported without a modifier. This aligns with the principles of accurate representation of services rendered, as outlined in CPT guidelines and payer policies, ensuring appropriate reimbursement for both aspects of the service. Incorrect approach is analysis. One incorrect approach would be to only code the technical component of the radiology service. This fails to capture the professional interpretation and reporting, leading to underpayment and a failure to accurately reflect the services provided by the physician. This is a regulatory failure, as it misrepresents the scope of services billed. Another incorrect approach would be to code the full CPT code for the radiology procedure, without considering whether the professional component was performed by a separate entity, or if payer rules require modifier -26. This could lead to duplicate billing or incorrect reimbursement if the professional component was billed separately or not performed by the same provider. This is an ethical and regulatory failure, as it can result in improper billing practices. A third incorrect approach would be to use an incorrect modifier or no modifier when the professional component was indeed performed by a separate physician or entity. This would result in the claim being processed incorrectly, likely leading to denial or underpayment, and failing to adhere to established coding conventions and payer requirements. This represents a failure to follow established coding guidelines and payer policies. Professional reasoning. Professionals should employ a decision-making framework that begins with a thorough review of the medical documentation. This includes understanding the specific radiology procedure performed, who performed the technical component, and who performed the professional component, interpretation and report. Next, consult the current CPT manual for the appropriate code for the imaging procedure. Then, determine if modifier -26 is applicable based on the documentation and payer guidelines. Finally, verify the payer's specific billing and reporting requirements for radiology services, as these can vary. This systematic approach ensures accuracy, compliance, and optimal reimbursement. Question 10. Regulatory review indicates that a physician's documentation describes a patient presenting with symptoms of dyspnea and peripheral edema, with the physician's assessment noting congestive heart failure with pulmonary congestion and bilateral lower extremity edema. The coder must accurately represent this clinical scenario. Which of the following approaches best reflects the structure and function of the major organs involved in this patient's presentation? Option A. Code for dyspnea and peripheral edema as separate, unrelated conditions, as they are distinct symptoms affecting different parts of the body. Option B. Code only for pulmonary congestion and bilateral lower extremity edema, as these are the most immediately observable symptoms described. Option C. Code for each organ system mentioned in the documentation without establishing a primary disease process or causal relationship. Option D. Identify the primary organ system affected by the documented diagnosis of congestive heart failure and code for it, understanding that pulmonary congestion and peripheral edema are direct consequences of its impaired function. The correct answer is A. Code for dyspnea and peripheral edema as separate, unrelated conditions, as they are distinct symptoms affecting different parts of the body. Explanation. Scenario analysis. This scenario presents a challenge for a medical coder by requiring them to interpret a physician's documentation regarding a patient's cardiac condition and its impact on other organ systems. The complexity arises from the need to accurately identify the primary organ affected, the heart, and understand how its dysfunction can lead to secondary issues in other organs, such as the lungs or kidneys, as described in the documentation. Misinterpreting the primary versus secondary organ involvement can lead to incorrect coding, impacting patient care, billing accuracy, and statistical reporting. Correct approach analysis. The correct approach involves a thorough understanding of the structure and function of the major organs, particularly the cardiovascular and respiratory systems, as well as the kidneys. This knowledge allows the coder to correctly identify the primary site of the disease process described by the physician and to understand the physiological consequences of that disease on other organs. By accurately mapping the documented symptoms and diagnoses to the correct organ systems and their interrelationships, the coder can select the most appropriate ICD-10-CM codes that reflect the patient's complete clinical picture, adhering to coding guidelines, and ensuring accurate reimbursement and data integrity. This aligns with the CPC exam's focus on applying medical knowledge to coding practices. Incorrect approach is analysis. One incorrect approach would be to focus solely on the symptoms described without understanding their origin within a specific organ system. For example, coding only for shortness of breath without recognizing it as a potential consequence of heart failure would be a failure to grasp the underlying organ system dysfunction. This violates the principle of accurate diagnostic coding, which requires identifying the root cause of the patient's condition. Another incorrect approach would be to code for each mentioned organ system independently without establishing the primary disease process. If the physician documents heart failure leading to pulmonary edema, coding for both heart failure and pulmonary edema as separate, unrelated conditions, rather than recognizing the pulmonary edema as a manifestation of the heart failure, would be a significant coding error. This misrepresents the patient's condition and the causal relationship between diagnoses, failing to adhere to coding conventions that prioritize the underlying etiology. A further incorrect approach would be to assume the most commonly affected organ based on a symptom, rather than relying on the physician's documentation. For instance, if a patient presents with chest pain, assuming it is always cardiac in origin without considering other possibilities documented by the physician, e.g., musculoskeletal or gastrointestinal, would be a flawed methodology. This demonstrates a lack of critical analysis of the provided clinical information and a reliance on generalizations, which is contrary to the precise nature of medical coding. Professional reasoning. Medical coders must develop a robust understanding of human anatomy and physiology to accurately interpret physician documentation. When faced with complex cases involving multiple organ systems, the decision-making process should involve 1. Carefully reading and understanding the physician's narrative, identifying all documented conditions and symptoms. 2. Applying knowledge of organ system structure and function to determine the primary site of disease and any secondary manifestations. 3. Consulting coding guidelines and conventions to ensure the correct sequencing and selection of codes that accurately reflect the patient's clinical status and the relationships between diagnoses. 4. Verifying the accuracy of the coded diagnoses against the documentation to ensure compliance with payer requirements and ethical coding standards. Question 11. The efficiency study reveals a pattern of inconsistent coding for patients presenting with both a chronic condition and an acute exacerbation of that same condition. For a patient admitted with a severe asthma exacerbation, who also has a documented history of chronic asthma, what is the most appropriate coding approach to accurately reflect the encounter? Option A. Code only the chronic asthma as the principal diagnosis, as it is the underlying condition. Option B. Code the chronic asthma as the principal diagnosis and the acute asthma exacerbation as a secondary diagnosis. Option C. Code the acute asthma exacerbation as the principal diagnosis and the chronic asthma as a secondary diagnosis. Option D. Code both the chronic asthma and the acute asthma exacerbation as principal diagnoses. The correct answer is C. Code the acute asthma exacerbation as the principal diagnosis and the chronic asthma as a secondary diagnosis. Explanation. Scenario analysis. This scenario presents a common challenge in medical coding where a patient has both a chronic underlying condition and an acute exacerbation of that condition. Accurately coding these situations requires a deep understanding of coding guidelines, particularly the distinction between principal diagnoses and secondary diagnoses, and how to represent the relationship between chronic and acute states. The challenge lies in ensuring the documentation supports the chosen codes, and that the coding accurately reflects the patient's overall health status and the reason for the encounter, impacting reimbursement and quality metrics. Correct approach analysis. The correct approach involves identifying the principal diagnosis as the acute condition that occasioned the admission or encounter, provided it is supported by documentation. A chronic condition, if it impacts the management or treatment of the acute condition, should be coded as a secondary diagnosis. This aligns with the fundamental principles of ICD-10-CM coding guidelines, which prioritize the condition chiefly responsible for the services rendered. This ensures accurate reporting of the patient's immediate medical needs, while also acknowledging the underlying chronic issue that may influence care. Incorrect approach is analysis. Coding only the chronic condition as the principal diagnosis would be incorrect, because it fails to capture the acute reason for the patient's current encounter. This misrepresents the primary focus of the medical services provided and could lead to underreporting of acute care services. Coding both conditions as principal diagnoses is not permissible under ICD-10-CM guidelines, as there can only be one principal diagnosis. This violates the fundamental structure of diagnostic coding, coding the acute condition as a secondary diagnosis, and the chronic condition as the principal diagnosis would invert the coding hierarchy, inaccurately portraying the chronic condition as the primary reason for the encounter when it is the acute exacerbation that necessitated the current medical services. Professional reasoning. Professionals should approach such scenarios by first thoroughly reviewing the physician's documentation to identify the primary reason for the patient's visit or admission. They must then consult the ICD-10-CM official guidelines for coding and reporting to determine the appropriate sequencing of diagnoses, paying close attention to guidelines regarding acute exacerbations of chronic conditions. This systematic process ensures compliance with coding standards and accurate representation of patient care. Question 12. Risk assessment procedures indicate that a physician documents generalized weakness for a patient encounter, but no definitive diagnosis is established for the cause of this weakness. The physician's notes do not suggest any specific underlying condition that explains the generalized weakness. Which of the following represents the most appropriate ICD-10-CM coding approach in this scenario? Option A. Assign an ICD-10-CM code for generalized weakness as a symptom. Option B. Do not assign an ICD-10-CM code for generalized weakness, as it is not a definitive diagnosis. Option C. Assign an ICD-10-CM code for a less specific condition, such as unspecified symptoms. Option D. Assign an ICD-10-CM code for a common underlying condition associated with generalized weakness, such as fatigue. The correct answer is A. Assign an ICD-10-CM code for generalized weakness as a symptom. Explanation. Scenario analysis. This scenario presents a common challenge in medical coding, where a provider documents a condition that is not explicitly listed as a definitive diagnosis, but is instead described as a symptom or a finding that may be related to an underlying condition. The professional challenge lies in accurately translating this clinical documentation into the appropriate ICD-10-CM code, adhering strictly to coding guidelines, and ensuring the code reflects the most specific and accurate representation of the patient's condition as documented. Misinterpretation can lead to inaccurate billing, suboptimal patient care planning, and potential compliance issues. Correct approach analysis. The correct approach involves a thorough review of the ICD-10-CM official guidelines for coding and reporting, specifically focusing on guidelines related to signs and symptoms, and the concept of code first, or use additional code instructions. When a definitive diagnosis is not established, and the documentation only includes signs and symptoms, coders are instructed to code the signs and symptoms. The key is to identify if the documented symptom is integral to a more specific condition that is also documented or if it is a standalone symptom. In this case, the documentation of generalized weakness without a confirmed underlying cause necessitates coding the symptom itself, as per the guidelines. This represents best professional practice because it adheres to the principle of coding what is documented when a definitive diagnosis is absent, ensuring compliance with coding standards and accurate reflection of the patient's clinical status at the time of service. Incorrect approaches analysis. One incorrect approach would be to assume an underlying diagnosis based on the symptom of generalized weakness. This violates the fundamental principle of coding based on documented evidence. ICD-10-CM guidelines prohibit the assignment of codes for conditions that are not documented. Ethically and regulatorily, this is unacceptable as it can lead to fraudulent billing and misrepresentation of patient conditions. Another incorrect approach would be to assign a code for a less specific condition if a more specific symptom code is available and appropriate based on the documentation. For instance, if the documentation clearly points to generalized weakness as the primary issue being addressed, and no other definitive diagnosis is made, coding a broader, less specific category will be a failure to adhere to the ICD-10-CM guideline of coding to the highest level of specificity documented. This can impact data analysis and reimbursement. A third incorrect approach would be to leave the condition uncoded or to assign a placeholder code without proper justification. While it is crucial not to code conditions not documented, it is equally important to code all documented conditions that affect patient care and require management. Leaving a significant symptom uncoded can lead to incomplete medical records and inaccurate reporting of the patient's health status. Professional reasoning. Professionals should approach such scenarios by first meticulously reviewing the provider's documentation. They must then consult the ICD-10-CM alphabetic index and tabular list, paying close attention to any instructional notes, code first, or use additional code directives, and the definition of the codes. If ambiguity exists, the coder should query the provider for clarification to obtain a more definitive diagnosis or confirmation that the documented symptom is indeed the condition being treated. This iterative process of documentation review, guideline application, and provider communication ensures accurate and compliant coding. Question 13. Implementation of accurate coding practices for a surgical procedure performed multiple times on the same patient during a single operative session requires careful consideration of modifier application. A surgeon performs a specific laparoscopic lysis of adhesions 3 times during a single surgical encounter. The operative report clearly documents each distinct instance of lyses. Which of the following best represents the correct application of CPT modifiers in this scenario to ensure accurate reporting and compliance? Option A. Report the primary CPT code for lyses of adhesions once, appending modifier 50 to indicate a bilateral procedure. Option B. Report the primary CPT code for lyses of adhesions 3 times, appending modifier 59 to each instance to denote distinct procedural services. Option C. Report the primary CPT code for lyses of adhesions once, appending modifier 51 to indicate multiple procedures. Option D. Report the primary CPT code for lyses of adhesions once, without any modifier, as it was performed during a single operative session. The correct answer is C. Report the primary CPT code for lyses of adhesions once, appending modifier 51 to indicate multiple procedures. Explanation. Scenario analysis. This scenario presents a common challenge in medical coding where a single procedure is performed multiple times on the same patient during a single operative session. The professional challenge lies in accurately reflecting the service provided to ensure appropriate reimbursement and compliance with payer guidelines, while also adhering to CPT coding conventions. Misinterpreting the use of modifiers in such situations can lead to undercoding or overcoding, both of which have significant regulatory and financial implications. Careful judgment is required to select the modifier that precisely communicates the circumstances of the service. Correct approach analysis. The correct approach involves appending the appropriate modifier to indicate multiple procedures of the same type performed during a single session. This accurately reflects the provider's work and ensures that the payer understands the extent of the services rendered. Adhering to CPT guidelines for modifier usage, specifically those related to multiple procedures, is paramount for accurate reporting and compliance with federal regulations governing healthcare billing. This approach upholds the integrity of the coding process and supports fair reimbursement. Incorrect approach is analysis. Reporting the procedure without any modifier fails to communicate that the service was performed multiple times, leading to underreporting of services and potential financial loss for the provider. This is a direct violation of CPT coding principles and can be construed as a failure to accurately represent the services rendered, potentially leading to payer audits and recoupments. Appending a modifier that signifies a different circumstance, such as a bilateral procedure or a discontinued service, is incorrect because it misrepresents the actual service performed. This constitutes a deliberate misrepresentation of facts, which is a serious ethical and regulatory violation, potentially leading to fraud and abuse investigations. Using a modifier that is not recognized by CPT or the specific payer for this scenario is also incorrect. This demonstrates a lack of knowledge of current coding guidelines and can result in claim rejections or denials, delaying payment and requiring rework. It also indicates a failure to stay current with coding standards, which is a professional responsibility. Professional reasoning. Professionals should approach such scenarios by first thoroughly reviewing the operative report to understand the exact nature and number of procedures performed. Next, they must consult the current CPT manual for guidelines on reporting multiple procedures and relevant modifiers. Payer-specific policies should also be reviewed, as some payers may have unique requirements. When in doubt, seeking clarification from the provider or consulting with experienced coding professionals or official coding resources is essential to ensure accurate and compliant reporting. Question 14. The control framework reveals a patient encounter where a fall resulted in a fracture of the left tibia. The patient's medical history is significant for metastatic lung carcinoma. The physician's documentation clearly indicates the fracture is the primary reason for this admission and treatment. Which coding approach best reflects the patient's condition and the circumstances of the encounter according to ICD-10-CM guidelines? Option A. Code the fracture of the left tibia as the principal diagnosis, followed by the external cause code for the fall, and then the code for metastatic lung carcinoma. Option B. Code the fracture of the left tibia as the principal diagnosis and the metastatic lung carcinoma, omitting the external cause code for the fall. Option C. Code the metastatic lung carcinoma as the principal diagnosis, followed by the fracture of the left tibia and the external cause code for the fall. Option D. Code the metastatic lung carcinoma and the fracture of the left tibia, sequencing them based on the physician's subjective assessment of their severity, and omit the external cause code. The correct answer is A. Code the fracture of the left tibia as the principal diagnosis, followed by the external cause code for the fall, and then the code for metastatic lung carcinoma. Explanation. This scenario presents a common challenge in medical coding, accurately classifying a neoplasm with associated injury and external cause information. The professional coder must navigate the complexities of ICD-10-CM coding guidelines, specifically those pertaining to neoplasms, injuries, and external causes of morbidity and mortality. The challenge lies in determining the correct sequencing and selection of codes to fully represent the patient's condition and the circumstances surrounding the injury, ensuring accurate data for billing, research, and public health reporting. The correct approach involves a systematic application of ICD-10-CM official guidelines for coding and reporting. For neoplasms, the guidelines dictate that the primary malignancy is coded first, followed by secondary malignancies if applicable. However, when a neoplasm is the reason for an encounter and is not being treated, but an injury is, the injury code takes precedence. In this case, the patient presents with a fracture injury that is a direct result of a fall external cause. The presence of a metastatic neoplasm is a significant comorbidity, but not the primary reason for this specific encounter, which is the management of the fracture. Therefore, the principal diagnosis should be the fracture, followed by the external cause code for the fall, and then the code for the metastatic neoplasm. This sequencing ensures that the immediate reason for the encounter is captured first, followed by the circumstances of the injury, and then the underlying condition. This aligns with the principle of coding the condition that occasioned the admission or encounter as the principal diagnosis, unless otherwise specified by the guidelines. An incorrect approach would be to code the neoplasm as the principal diagnosis. This fails to adhere to the guideline that, when an injury is the reason for the encounter, the injury code should be sequenced first, even in the presence of a comorbidity like a neoplasm. This misrepresents the primary reason for the patient's visit and can lead to inaccurate statistical data and billing. Another incorrect approach would be to omit the external cause code. The ICD-10-CM guidelines mandate the reporting of external causes of injury and poisoning codes to provide a complete picture of the circumstances surrounding the injury. Failing to include this code results in incomplete data and hinders efforts to understand injury patterns and implement preventive measures. A further incorrect approach would be to code the neoplasm and the fracture without considering the relationship between them and the fall. The guidelines for coding neoplasms often require specific sequencing when they are the reason for the encounter or when they influence treatment. However, in this specific scenario, the fracture is the direct result of the fall, and the neoplasm is a separate, albeit important, comorbidity. Coding must reflect the causal relationship between the fall and the fracture, and then separately report the neoplasm. The professional decision-making process for similar situations involves a thorough review of the medical record, identification of all diagnoses and conditions, and a meticulous application of the ICD-10-CM official guidelines for coding and reporting. Coders must prioritize the principal diagnosis based on the reason for the encounter, then sequence secondary diagnoses and external cause codes according to established guidelines. When in doubt, consulting coding resources, querying the physician for clarification, and seeking peer review are essential steps to ensure accuracy and compliance. Question 15. Benchmark analysis indicates that coders often face challenges in accurately reporting claims for durable medical equipment, DME. A physician's order specifies a power wheelchair for a patient with severe mobility impairment. The supplier provides the wheelchair and obtains a signed delivery confirmation. The coder is tasked with submitting the claim. Which of the following approaches best ensures accurate coding and compliance with Medicare DME guidelines? Option A. Assign a general ICD-10 code for difficulty walking and the HCPCS level Roman II code for a standard manual wheelchair, assuming the physician's order is sufficient and the supplier's confirmation implies medical necessity. Option B. Assign the HCPCS level Roman II code for a power wheelchair based on the physician's order alone, without independently verifying the specific diagnosis or checking Medicare's coverage policies for power wheelchairs. Option C. Assign the most specific ICD-10 code that accurately reflects the patient's severe mobility impairment and the HCPCS level Roman II code for a power wheelchair, after verifying that the physician's order and supplier documentation meet Medicare's requirements for medical necessity and proof of delivery. Option D. Assign the most specific ICD-10 code for the patient's condition and the HCPCS level Roman II code for a power wheelchair, without reviewing the supplier's documentation or confirming Medicare's specific coverage criteria for this type of equipment. The correct answer is C. Assign the most specific ICD-10 code that accurately reflects the patient's severe mobility impairment and the HCPCS level Roman II code for a power wheelchair, after verifying that the physician's order and supplier documentation meet Medicare's requirements for medical necessity and proof of delivery. Explanation. This scenario presents a common challenge in medical coding, particularly with durable medical equipment (DME), where accurate documentation and adherence to payer guidelines are paramount. The professional coder must navigate the complexities of physician orders, supplier documentation, and payer-specific policies to ensure correct coding and prevent claim denials or audits. The challenge lies in interpreting the physician's intent for the DME, verifying its medical necessity as documented, and applying the appropriate ICD-10 and HCPCS level Roman II codes according to Medicare's DME policies, which are the primary regulatory framework for this exam. The correct approach involves a thorough review of the physician's order, ensuring it clearly specifies the DME item, the diagnosis supporting its medical necessity, and the duration of need. This is followed by verifying that the supplier's documentation corroborates the physician's order and meets Medicare's requirements for proof of delivery and beneficiary acknowledgement. Coding the claim using the most specific ICD-10 diagnosis code that supports the medical necessity of the prescribed DME, and then selecting the correct HCPCS level Roman II code for the DME itself, based on its function and Medicare's coverage guidelines, represents best professional practice. This meticulous process ensures compliance with Medicare's local coverage determinations, LCD, and national coverage determinations, NCD, for DME, minimizing the risk of claim rejections and ensuring appropriate reimbursement. An incorrect approach would be to code based solely on the physician's order, without verifying supporting documentation or payer policies. This could lead to coding a DME item that is not medically necessary according to payer guidelines, or using a diagnosis code that does not adequately support the need for the equipment. Another incorrect approach is to assume coverage for all DME items, without consulting relevant LCDs/NCDs, which can result in coding items that are explicitly excluded or require specific prior authorization. Relying on past coding practices without confirming current payer policies is also a failure, as guidelines for DME coverage and coding can change. These failures violate the principles of accurate coding, potentially leading to fraudulent claims, financial penalties, and damage to the provider's reputation. Professional decision-making in such situations requires a systematic approach. First, understand the patient's condition and the physician's prescribed treatment. Second, meticulously review all supporting documentation for completeness and accuracy. Third, consult payer-specific policies, including LCDs and NCDs, for coverage criteria and coding guidelines for DME. And finally, apply the most accurate and specific ICD-10 and HCPCS level Roman II codes based on this comprehensive review. Question 16. Cost-benefit analysis shows that using a more general HCPCS level Roman II code for a specific medical supply might save a few seconds per claim. But what is the primary ethical and regulatory imperative when selecting HCPCS Level Roman II codes for reporting medical supplies? Option A. Create a unique identifier for the supply if no exact HCPCS Level Roman II code is readily available. Option B. Utilize a general code if the specific code is not commonly known or easily recalled by the billing staff. Option C. Select the most specific HCPCS Level Roman II code that accurately describes the medical supply provided, regardless of time savings. Option D. Prioritize using codes that are most frequently encountered in the billing system to expedite processing. The correct answer is C. Select the most specific HCPCS Level Roman II code that accurately describes the medical supply provided, regardless of time savings. Explanation. Scenario analysis. This scenario presents a professional challenge where a medical coder must navigate the correct application of HCPCS Level Roman II codes when faced with a situation where a more specific code exists but a less specific, more commonly used code might be tempting to use due to familiarity or perceived ease. The challenge lies in balancing efficiency with accuracy and adherence to coding guidelines, which are paramount for proper reimbursement and patient record integrity. The coder must exercise careful judgment to ensure the most appropriate code is selected, reflecting the true service provided. Correct approach analysis. The correct approach involves selecting the most specific HCPCS Level Roman II code that accurately describes the service or supply provided. This aligns directly with the fundamental principles of medical coding and the structure of HCPCS Level Roman II itself. HCPCS Level Roman II is designed with a hierarchical structure where more specific codes exist to capture nuances in services, supplies, and procedures that are not adequately represented by general codes. Using the most specific code ensures accurate reporting for statistical purposes, appropriate reimbursement based on the precise service rendered, and compliance with payer policies that often mandate the use of the most specific available code. This adheres to the principle of least but not last coding, meaning the coder should select the code that is least complex but still fully describes the service. Incorrect approaches analysis. One incorrect approach is to use a less specific, more general HCPCS Level Roman II code when a more specific code is available and applicable. This failure stems from a misunderstanding or disregard for the hierarchical nature of HCPCS Level Roman II and the principle of specificity in coding. This can lead to inaccurate data collection, potentially incorrect reimbursement, and noncompliance with payer guidelines. Another incorrect approach is to assume that a commonly used code is always appropriate, without verifying its specific applicability to the current service. This demonstrates a lack of diligence and adherence to coding best practices. A third incorrect approach might involve attempting to create a new code or modify an existing one, which is outside the scope of a coder's responsibilities and violates established coding conventions. Coders are expected to use existing, valid codes. Professional reasoning. Professionals should approach such situations by first thoroughly reviewing the documentation to understand the exact service, supply, or procedure performed. They should then consult the official HCPCS Level Roman II code set, paying close attention to code descriptions, parenthetical notes, and any instructional information provided within the code book or relevant payer guidelines. If ambiguity exists, seeking clarification from a supervisor, coding manager, or the healthcare provider is a crucial step. The decision-making process should prioritize accuracy, specificity, and compliance with all applicable regulations and guidelines. Question 17. Investigation of the physician's progress note states, patient presence with symptoms suggestive of perinephritis. As a certified professional coder preparing to assign an ICD-10-CM code, what is the most critical step in accurately interpreting this diagnostic statement? Option A. Rely on the common understanding that nephritis generally refers to kidney inflammation and assign a broad code for kidney disease. Option B. Assume peri is a common abbreviation for a less significant descriptor and focus primarily on the root word and suffix. Option C. Deconstruct the term perinephritis by identifying its root word, prefix, and suffix to understand the specific anatomical location and pathological process. Option D. Search for a direct ICD-10-CM code for perinephritis without analyzing the individual components of the term. The correct answer is C. Deconstruct the term perinephritis by identifying its root word, prefix, and suffix to understand the specific anatomical location and pathological process. Explanation. Scenario analysis. This scenario presents a professional challenge for a medical coder by requiring them to interpret a physician's documentation that uses a combination of medical terminology and abbreviations. The challenge lies in accurately translating these terms into standardized codes, ensuring that the specificity of the diagnosis is captured. Misinterpreting prefixes, suffixes, or root words can lead to incorrect coding, impacting patient records, billing accuracy, and potentially reimbursement. The need for precise understanding of anatomical and pathological terms is paramount. Correct approach analysis. The correct approach involves a thorough understanding of the root word, prefixes, and suffixes used in the physician's note. For example, understanding that nepher relates to the kidney, itis signifies inflammation, and peri means around, allows the coder to accurately interpret perinephritis as inflammation around the kidney. This detailed linguistic analysis of medical terms is fundamental to accurate medical coding and directly aligns with the requirements of the CPC exam, which emphasizes the application of coding guidelines and the understanding of medical terminology to assign the correct ICD-10-CM codes. Adhering to these principles ensures compliance with coding standards and accurate representation of patient conditions. Incorrect approaches analysis. An approach that focuses solely on the most common or obvious part of the term without considering the modifying prefixes or suffixes would be incorrect. For instance, if a coder only recognized nepher and ignored peri and itis, they might incorrectly code a general kidney condition instead of the specific inflammation around the kidney. This failure to analyze the complete term leads to a loss of specificity, violating the principle of coding to the highest degree of specificity required by ICD-10-CM guidelines. Another incorrect approach would be to rely on abbreviations or shorthand without verifying their meaning within the context of the documentation or established medical coding dictionaries. Abbreviations can be ambiguous and may have multiple meanings, leading to misinterpretation. This practice bypasses the rigorous analysis of terminology required for accurate coding and could result in a violation of coding accuracy standards. A third incorrect approach would be to guess the meaning of unfamiliar terms or to code based on a general impression of the patient's condition without dissecting the specific terminology used. This lacks the analytical rigor demanded by medical coding and can lead to significant coding errors, impacting the integrity of patient data and billing. Professional reasoning. Medical coders must adopt a systematic approach to documentation review. This involves breaking down complex medical terms into their constituent parts, root word, prefixes, suffixes, to understand the precise meaning. When encountering unfamiliar terms or abbreviations, coders should consult authoritative medical dictionaries, coding manuals, and official coding guidelines. If ambiguity persists, seeking clarification from the healthcare provider is a crucial step in professional practice. This methodical process ensures accuracy, compliance, and ethical coding practices. Question 18. What factors determine the appropriate reimbursement methodology to apply when submitting a medical claim to a specific payer? Option A. General industry coding standards that are not payer-specific. Option B. The coder's personal preference for a particular reimbursement model. Option C. The specific payer contract and their established reimbursement policies and guidelines. Option D. The most recently published coding updates from a national coding body. The correct answer is C. The specific payer contract and their established reimbursement policies and guidelines. Explanation. Scenario analysis. This scenario presents a common challenge in medical coding where the chosen reimbursement methodology can significantly impact revenue and compliance. The complexity arises from the need to accurately interpret payer policies, understand the nuances of different payment models, e.g., fee-for-service vs. value-based care, and ensure that coding practices align with the chosen methodology to avoid underpayment or overpayment, both of which carry significant risks. The coder must exercise careful judgment to select the most appropriate methodology that reflects the services rendered and complies with payer contracts and regulatory requirements. Correct approach analysis. The correct approach involves a thorough understanding of the specific payer contract and the applicable reimbursement methodology outlined within it. This includes identifying whether the payer utilizes a fee-for-service model, a bundled payment system, a capitated arrangement, or a value-based purchasing program. Best professional practice dictates that the coder meticulously reviews the payer's policy documents, coding guidelines, and any relevant contractual language to determine the established payment structure. This ensures that claims are submitted in a manner that accurately reflects the services provided and maximizes appropriate reimbursement according to the agreed-upon terms, thereby adhering to the principles of accurate billing and compliance with payer agreements. Incorrect approaches analysis. One incorrect approach is to assume that all payers use the same reimbursement methodology, such as a standard fee-for-service model, regardless of specific payer contracts or policy updates. This failure to recognize and adapt to diverse reimbursement structures can lead to incorrect claim submissions, resulting in denied claims, underpayments, or even overpayments that necessitate costly recoupments. Ethically and regulatorily, this demonstrates a lack of due diligence and a failure to comply with individual payer requirements. Another incorrect approach is to prioritize coding practices that might maximize reimbursement under one methodology, without considering the specific requirements of the payer's chosen reimbursement system. For instance, upcoding services or unbundling procedures when the payer operates under a bundled payment system would be a direct violation of payer policies and potentially fraudulent. This approach disregards the contractual obligations and the regulatory framework governing reimbursement, leading to non-compliance and potential penalties. A third incorrect approach is to rely solely on outdated coding guidelines or general industry knowledge without verifying current payer-specific policies. Reimbursement methodologies and their associated coding requirements are subject to frequent changes. Failing to stay abreast of these updates and verify current payer policies can result in submitting claims that are no longer compliant with the prevailing reimbursement methodology, leading to payment discrepancies and compliance issues. This reflects a lack of commitment to continuous learning and adherence to current regulatory standards. Professional reasoning. Professionals should adopt a systematic approach to reimbursement methodology determination. This begins with identifying the specific payer for each claim. Next, the coder must actively seek out and thoroughly review the payer's provider manual, policy bulletins, and contractual agreements related to reimbursement. When in doubt, direct communication with the payer's provider relations department is essential. This proactive and diligent approach ensures that coding practices are aligned with the payer's established reimbursement methodology, promoting accurate billing, maximizing appropriate reimbursement, and maintaining regulatory compliance. Question 19. When evaluating a patient encounter where a diagnostic imaging service was performed and documented by the physician, but the coder suspects it may not be covered by Medicare due to specific payer guidelines, what is the most appropriate course of action to ensure compliant billing? Option A. Research the relevant National Coverage Determination, NCD, or Local Coverage Determination, LCD, for the specific imaging service and diagnosis, and compare the patient's documentation against the criteria outlined in the determination before assigning codes. Option B. Advise the physician to resubmit the documentation with a different diagnosis that might be more likely to be covered by Medicare, even if it doesn't fully reflect the patient's condition. Option C. Assign the appropriate ICD-10-CM and CPT codes based on the physician's documentation and submit the claim, assuming Medicare will adjudicate it based on the service provided. Option D. Assign the CPT code for the imaging service, but omit the ICD-10-CM diagnosis code to avoid triggering a denial based on coverage limitations. The correct answer is C. Assign the appropriate ICD-10-CM and CPT codes based on the physician's documentation and submit the claim, assuming Medicare will adjudicate it based on the service provided. Explanation. Scenario analysis. This scenario presents a common challenge in medical coding where a provider's documentation supports a service, but a national coverage determination, NCD, or local coverage determination, LCD, may restrict reimbursement. The coder must navigate the complexities of these determinations, which are not always straightforward and can have specific criteria for medical necessity. The professional challenge lies in balancing the provider's intent to bill for services rendered with the payer's established coverage policies, ensuring compliance while advocating for appropriate reimbursement when justified. Correct approach analysis. The correct approach involves thoroughly reviewing the specific NCD or LCD relevant to the service and diagnosis. This includes understanding the detailed criteria, limitations, and any required documentation outlined in the determination. If the documentation meets these criteria, the coder can confidently assign codes that align with the NCD/LCD, supporting medical necessity and facilitating proper reimbursement. This approach represents best professional practice because it prioritizes adherence to established payer policies, which are legally binding for Medicare and other payers that follow NCDs/LCDs. It ensures accurate billing and minimizes the risk of claim denials and audits. Incorrect approaches analysis. One incorrect approach is to assume that because a service was performed and documented, it is automatically covered and reimbursable. This fails to acknowledge the existence and authority of NCDs and LCDs, which can override general coding guidelines if specific coverage criteria are not met. This approach risks significant claim denials, recoupments, and potential fraud allegations if done knowingly. Another incorrect approach is to code based solely on the provider's request or assumption of coverage without verifying against the relevant NCD/LCD. This abdicates the coder's responsibility to ensure compliance with payer policies. It can lead to improper billing practices and a breakdown in the provider-coder relationship if the coder does not proactively identify coverage issues. A third incorrect approach is to ignore the NCD/LCD if it appears restrictive and proceed with coding as if it doesn't exist. This is a direct violation of payer policies and can be considered a deliberate attempt to circumvent coverage limitations. Ethically and legally, this is unacceptable and can result in severe penalties. Professional reasoning. Professionals should adopt a systematic approach. First, identify the service and diagnosis. Second, research any applicable NCDs or LCDs for that specific payer and region. Third, meticulously compare the patient's documentation against the criteria outlined in the NCD/LCD. If the documentation meets the criteria, code accordingly. If it does not, or if there is ambiguity, the coder should consult with the provider to obtain clarifying documentation or discuss alternative services that may be covered. This proactive and diligent process ensures compliance, supports accurate billing, and fosters a collaborative relationship with the provider. Question 20. The monitoring system demonstrates a recurring pattern of incorrect code assignment for conditions within Chapter 4 of the ICD-10-CM manual, specifically related to diabetes mellitus with complications. The coder has been observed to frequently assign codes for uncomplicated diabetes when documentation clearly indicates the presence of neuropathy. Which of the following actions best addresses this coding deficiency according to the CPC exam preparation for medical coding certification framework? Option A. Update the practice's internal coding manual with a simplified rule for diabetes coding to streamline the process, bypassing the need to consult official guidelines for each case. Option B. Advise the coder to rely on common practice and the most frequently used codes for diabetes, as this generally reflects typical patient populations. Option C. Review and re-educate on the specific ICD-10-CM coding guidelines for diabetes mellitus, emphasizing the hierarchical structure of codes and the importance of sequencing based on the presence of complications as detailed in Chapter 4 guidelines. Option D. Implement a retrospective audit of all diabetes-related claims from the past year to identify and correct any similar coding errors, without further review of the specific guidelines. The correct answer is C. Review and re-educate on the specific ICD-10-CM coding guidelines for diabetes mellitus, emphasizing the hierarchical structure of codes and the importance of sequencing based on the presence of complications as detailed in Chapter 4 guidelines. Explanation. The monitoring system demonstrates a pattern of inconsistent coding for a specific chapter of the ICD-10-CM manual, specifically related to endocrine, nutritional, and metabolic diseases. This scenario is professionally challenging because accurate coding directly impacts patient care documentation, billing accuracy, and statistical reporting. The medical coder must possess a thorough understanding of the chapter-specific coding guidelines to ensure compliance with the ICD-10-CM official guidelines for coding and reporting. The correct approach involves a systematic review of the identified coding inconsistencies by consulting the relevant ICD-10-CM chapter-specific guidelines and any applicable addenda or updates. This ensures that the coder is applying the most current and accurate coding principles for endocrine, nutritional, and metabolic diseases. This approach represents best professional practice because it prioritizes adherence to official coding guidelines, which are the foundation of compliant and accurate medical coding. It demonstrates a commitment to professional development and quality assurance, ensuring that the coding reflects the patient's condition accurately and supports appropriate reimbursement and data analysis. An incorrect approach would be to assume the inconsistencies are minor errors and to simply correct them without understanding the underlying guideline. This fails to address the root cause of the errors and leaves the coder vulnerable to repeating the same mistakes. Another incorrect approach is to rely on anecdotal evidence or the coding practices of colleagues without verifying against official guidelines. This is a significant regulatory and ethical failure as it deviates from established standards and can lead to widespread coding inaccuracies and noncompliance. Furthermore, ignoring the pattern and continuing to code without seeking clarification or further education is a dereliction of professional duty, potentially leading to fraudulent claims and impacting public health data. Professional decision-making in such situations requires a commitment to continuous learning and a proactive approach to identifying and resolving coding discrepancies. Coders should regularly review coding guidelines, participate in continuing education, and utilize available resources to ensure their knowledge is up to date. When inconsistencies are identified, the professional approach is to investigate the cause, consult the official guidelines, and implement corrective actions that include education and process improvement to prevent future errors.